The holidays are here, and that means lots of tempting foods like mac and cheese and pumpkin pie. You know what we mean. But those tasty temptations can also lead to higher health risks, especially for older adults with diabetes. Not managing diabetes could have serious, even life-threatening consequences. Dr. Renee Roberts of Oak Street Health is here with some advice on maintaining control of your diabetes while enjoying holiday treats. She's also highlighting the importance of treating the whole person physically and emotionally when it comes to managing chronic conditions. Welcome, Dr. Roberts.
Thank you so much.
What are some of the biggest challenges older adults with diabetes face during the holidays?
Yes, well, I think some of the biggest challenges this time of year for older adults with diabetes, first and foremost, is navigating the food. We know there's lots of sweet foods, lots of carbohydrate-rich foods, which can raise blood sugars and pose potential health risks for patients. I also like to think about the disruption to one's daily routine. Think about it. A lot of people might be traveling by plane or bus or car to go visit loved ones, and that can throw off someone's regular routine. Right? They may not be able to take their medications as planned or may not have access to healthy, nutritious meals. And definitely need to have a conversation this time of year about isolation and loneliness. We know the holidays are a happy time for many of us, but for a lot of older adults who might be shut in or have physical limitations and they're not able to visit family and friends as often as they'd like, that can create a lot of emotional issues and depression, just to name a few.
Let's focus on the food first. What are some easy swaps families can make to support their loved ones with diabetes?
Yes, well, there's lots of healthy food swaps. I like to start with the vegetables first, right? We know we can opt for steamed vegetables or roasted vegetables instead of going for things like the candied yams or the creamy casseroles. I also like to keep in mind about the sugary beverages, right? There's lots of times that we'll have access to juices or punches, and that can add a lot of extra calories as well. One of the other healthy food swaps you can do is to think about fruits and herbs. So things like lemons, limes, oranges, garlic. These things add a ton of flavor without adding additional salt or sugar.
Why is diabetes so worrisome for older adults?
Yes, diabetes, is a chronic condition that can be very worrisome for older adults. And, I tell people it's not necessarily the diabetes itself, but the complications from the diabetes. It creates a ripple effect throughout the body, particularly with regards to the smallest blood vessels. So these are the blood vessels that supply your retina in the back of your eye, supply your fingertips, sensation on the soles of your feet, and your kidneys. When blood sugars are uncontrolled, as it is with the case with many diabetics, then what can happen is you can develop vision loss, you can develop numbness and tingling in your hands and feet, as well as chronic kidney disease.
Tell us why it's important to treat the whole person when managing diabetes and how you and your team help patients do that.
Yes, that's correct. When managing chronic conditions such as diabetes, you definitely need to treat the entire person. It's not just what I provide as a medical doctor, but we also have to think about the emotional and the social aspects. Again, particularly this time of year with regards to isolation and loneliness. At Oak Street Health, we do a great job of treating the whole patient. So you will not only see physicians or nurse practitioners or physician assistants, but we also have social workers. We have community health workers and behavioral health specialists to help provide wraparound care for our patients during this time of year.
Where can our viewers go to learn even more?
Yes, well, if you're interested in learning more about Oak Street Health or you would like to schedule a visit, please pick up the phone and give us a call at 855-337-0583.